Oopsie. I forgot to turn my camera on. My apologies. Just back at this, so I'm going to make mistakes. I've been away for a bit. Picking up where we left off from yesterday, this is part 2 of medical fraud. To recap what we discussed yesterday, I'm going to go over a few things here. We were talking about Jeff and Teresa. Jeff and Teresa were sold on the idea that Dayan Goodnow told them that it's basically human biochemical engineering. He had stated on Dr. Amy Novotny's Real Awaken Your Health podcast late last year. He says if you actually provide the cells of the human body with the ingredients that they need and then put yourself in an environment that stimulates that adaptability, the body will fix itself. Total cost of the 4-month live-in program is $75,000 US. Jeff and Teresa were sold on this. I was really going to work hard to be the most improved, Jeff said. Questions emerge. The couple arrived in Moose Jaw in early September 2024. It didn't take long for questions to emerge. To them, the facility didn't seem set up for people with serious degenerative diseases and mobility issues. For example, the only way you get to the second floor, where the kitchen is a staircase, making it inaccessible for many residents like Jeff. Goodnow acknowledged that issue. We always laugh about the stairs, Goodnow said. People say, Dayan, when are you going to put an elevator in your facility? He said, you can look at the stairs as part of the program. They'll come in not being able to walk or basically not being able to get out of a wheelchair. And the goal is, within 3 months, to get them walking upstairs, Goodnow said. Teresa said that once during an assessment, the staff left Jeff standing for too long, and he fell. He didn't go backward or forward. He just crumpled, she said. And neither of the staff caught him, and his legs were completely underneath him, and he was screaming in pain, and they couldn't get him up. That's when I became a little skeptical that, okay, they might not have the right personnel here to deal with ALS patients, Jeff said. He said he was surprised to learn that there were no doctors or nurses on staff. Goodnow told CBC he shouldn't have been surprised because we are not a medical facility. We do not provide medical care. Despite Jeff's concerns, he reminded himself that his primary reason for being there was the supplements. He still had great hope that they would work as promised. Self-directed research. Goodnow provided Jeff and the other clients with a detailed day-by-day list of supplements to take at 8 a.m., noon, 4 p.m., and bedtime. The protocol includes many familiar products like creatine powder, collagen, magnesium, and zinc. It also includes regular doses of Goodnow's patented Plasma Logan-based products like NeuroPC Plus and Glia PC Plus. I have no idea what those things are. There is a copy I can show you of the... I will show you folks later, the supplement schedule protocol. It's interesting to say the least. Dr. Goodnow Restorative Health Supplement Schedule Protocol. I will share that with you later. At the bottom of the sheet, there was a footnote. This is a self-directed program. This protocol may be modified to suit your lifestyle and/or preferences. There's the loophole. In an interview with CBC, Goodnow reiterated that point. We are here as a self-directed research process. People come in of their own voluntary will and they develop programs for themselves, Goodnow said. CBC asked Jeff about his this self-directed, in quotation, research idea. He said this was the first that had been brought to his attention and he never would have gone to Moose Jaw if he had known that was the deal. So the patient in this non-medical facility knew nothing about the self-directed research program. Had he known, he wouldn't have gone. He said, that's exactly the opposite of why I went to him. I went to him because he's the supposedly neuroscientist. I don't know anything about what to include. How am I going to self-direct? You tell me this is what I need to get better, I'm going to take it. Jeff said at no point did he develop his own program. The only thing I can figure out as a business person is that he's trying to limit his liability and trying to claim, well, this is self-directed. It's not really designed by me, it's designed by the patient, said Jeff. Timothy Caulfield, the U of A law professor who specializes in legal and ethical issues in medical research, agrees. Quote, he wants to avoid the claim that he's providing medicine, right? That he's acting as a physician, Caulfield said. And his defense will be, I'm just providing these people with information, and they're doing it themselves. For decades, Caulfield has studied and written about what he regards as dubious medical claims. He's written academic and mainstream books like Is Gwyneth Paltrow Wrong About Everything? And The Cure for Everything, Untangling the Twisted Messages About Health, Fitness, and Happiness. He reviewed Goodnow's website and said he's seen familiar patterns. We've studied this space for decades, and this is the go-to strategy. Heavily imply that you can cure the condition without explicitly saying you can cure the condition, Caulfield said. Caulfield said if Goodnow could really do what he's claiming, he should be publishing this in leading biomedical journals, having his claims and his data peer-reviewed by experts in the field, because it would be absolutely extraordinary. He said that the fact that this hasn't happening is telling. This hasn't happened is telling. If this individual really could do this, I promise you, we would hear about it, right? This secret treatment would not be secret, Caulfield said. And there's no evidence that I'm aware of that would support those claims. What's the evidence? Well, earlier this year, CBC asked Dayan Goodnow for an interview about the evidence that backs up his extraordinary contention that his plasma Logan-based program can halt the progression of ALS symptoms and set patients on the path to recovery. CBC asked if he could point to any published scientific studies that back up his claim. Not published at this point in time, he said. CBC asked why those studies hadn't been done. We're actually starting them right now, he said. I'm just in negotiations with them. And he added that these sorts of studies are not necessarily for our clientele and our doctor network. This is a nutritional supplement. It's food, basically. Okay? It's restoring food. When pressed for evidence of his claims, Goodnow points to people that seem to improve while taking his supplements. Well, during the Moose Jaw facility, CBC spoke with 65-year-old Scott Myers, who had arrived from Akron, Ohio, just a few weeks earlier. Within the first week, I don't know if it was psychosomatic, but I had recovered the last movements that I had lost a couple of weeks prior to that, Myers said. Goodnow also points to Corey Mitchell in the video posted on Goodnow's website. The 49-year-old former race car driver says the disease has completely stopped. There's been no progression at all. Goodnow said the conclusion is clear. The actual progression of the disease can be stopped. Okay, fundamentally, unambiguously, his progression stopped, Goodnow said. It only takes one person to get better to falsify the hypotheses that this is a disease that cannot be reversed. David Taylor, the Chief Scientific Officer of the ALS Society of Canada, said this sort of claim is not convincing. He points out that ALS does not take a linear path. He said it's well known that patients can hit plateaus where the disease can appear to stop progressing or even improve. He adds that sometimes improvements can be attributed to placebo effects. It is well known that in any form of medicine, people who spend a lot of money, who go through a regimen that is more invasive, who have any kind of promises associated with a particular therapy, that those individuals do better with their disease, Taylor said. He said he has seen no scientific evidence that plasmologins can do what Goodnow has claimed. If it were something that had a good, viable piece of information around it, we would all be looking at it. The world would go there because there'd be a lot of incentive to want to learn more about it, publish on it, make people's careers on it, and make money off of it as a pharmaceutical company, Taylor said. You have an individual person's hypotheses versus an entire field of people who are spending every moment of every day trying to find the thing that's going to fix the disease. You're saying Corey is a lie? Corey Mitchell's partner, Jennifer Hoff, said she did see improvement in his condition after began Goodnow's treatment program in Moose Jaw in the fall of 2023. She said his speech and ability to walk seemed to improve. She said it's possible that Goodnow's plasma logans helped, but also pointed out that Mitchell's stress levels dropped and his diet significantly improved while at the Moose Jaw facility. We changed his diet completely, she said. Of course, changing your diet and getting your inflammation down in your body's going to respond. Sorry about that. I had to cough. Now I'm going to take a sip of hot chocolate. Ooh, that's tasty. Mitchell left Moose Jaw in early 2024, and his condition remained stable. However, Hoff said, let's try that again. Mitchell left Moose Jaw in early 2024, and his condition remained stable. Hoff said Goodnow was clear regarding his view of Mitchell's improvement. He literally told him, "You've beat ALS. You're in recovery phase. Now we just have to work on building your muscles," she said. In the summer of 2024, months after Mitchell shot his testimonial video, he and Hoff agreed to help Goodnow promote the program by speaking with potential clients about the changes Mitchell had experienced. Goodnow agreed to pay a stipend of $2,000 a month. We were getting bombarded with phone numbers of all these people. "Hey, can you talk to so-and-so about Moose Jaw?" Hoff said. Then Mitchell's condition began to deteriorate once again. Hoff said he was no longer able to speak, and so he couldn't promote Goodnow's program. Hoff reached out to Goodnow for help. Not even a phone call back. And that's when I started to be like, something's not right here, she said. Mitchell died on October 21st, 2024. What he died from wasn't from ALS progression, Goodnow told CBC. His disease did not progress to his death. He died from other causes. When asked how he knew that Goodnow, when asked how he knew that, Goodnow said, "Because he was functionally better last time I saw him. He was walking around." Goodnow last saw Mitchell in the summer of 2024. Hoff said Goodnow's contention that Mitchell didn't die from ALS-related complications is a flat-out lie. "I was there when he died. I held his hand. I watched him die." According to Goodnow, Mitchell's testimonial video remains on his website because he's still a symbol of hope because he defied the odds. His caregiver, Jennifer, said he declined and died of ALS. All of Corey's improvements, all of the work that he put through to make himself better was all bullshit. "That's what you're saying to me right now," Goodnow said. "You're saying Corey is a lie." Sold a bill of goods. Corey Mitchell's story was instrumental in persuading Michael Geiselman to sign up for Goodnow's ALS program. Michael died on December 19th, 2024, about 4 months after he began the program. "He was just being sold a bill of goods, and I just had to let him," his wife Shannon said. That's how he chose to spend his last days. She said she watched Michael become a different person after learning of his diagnosis. She said the desperation to find a cure consumed him. It took away his whole spirit. It took away everything, she said. ALS is a no-win situation. The best you can do is just accept it and be happy right now and just live your life right now. Sorry. Jeff Sando is now back in California. His condition has deteriorated. Really didn't experience any halting of the progression while I was there or any time since, Jeff said. Actually, it seemed like it was picking up pace, not slowing down. He added that he became friends with several through the program and they have stayed in touch. And it wasn't just me, he said. Everybody had declined pretty significantly. Becky Batter is one of them. She was diagnosed with ALS in April 2024 and began attending Goodnow's Moose Jaw program in early September, one day before Jeff and Teresa arrived. According to her husband Eric, she was losing about a point a month on the 48-point ALS functional rating scale, a questionnaire that helps keep track of a patient's decline in speech, movement, and breathing. Then she began Goodnow's program. She lost 2 points the first month, 2 points the second month, 3 points the third month, said Eric, who attended the program with her. So her functionality decrease accelerated. Eric said he knows the disease is not linear, so he doesn't attribute her worsening condition to Goodnow's treatment. However, we definitely did not see any improvement. Absolutely not. Becky died on May 18th, 2025. When CBC pointed out to Goodnow that some of its clients said they had declined while on his program, he expressed doubt. So how documented is that decline? Do they have evidence of their decline, or is it just their opinion, he asked. We do document every single person that comes through our center, okay? They leave that center better than they came in, okay? And that's just simply a fact, okay? Health Canada steps in. Jeff and Teresa wonder how a facility like this is allowed to operate in Canada. Yeah, me too. They have filed complaints with Saskatchewan's College of Physicians and Surgeons and the Moose Jaw Police Service. They don't know where else to turn. Timothy Caulfield said this story highlights a real problem. Goodnow is not a medical doctor, so he's not under the jurisdiction of the College of Physicians and Surgeons. We need, as a society, to be able to transparently and appropriately stop individuals like this from doing what I think is clear and real harm, Caulfield said. The fact that we can't easily do it is really problematic. Some action has been taken. In January, Health Canada began investigating Goodnow's company. Following an on-site inspection on March 20th, 2025, Health Canada found the company was importing, advertising, and selling unauthorized natural health products, Health Canada said in a statement. All natural health products must be assessed by the government for safety before they can legally be sold in Canada. Health Canada says that since the inspection, the company confirmed they had stopped importing and selling unauthorized NHPs, natural health products. They also committed to not promoting unauthorized health products and corrected their website. Goodnow said Health Canada's concerns were based on a misunderstanding. He said individual clients are able to import up to a 90-day supply of the Plasma Logan supplements for personal use. He said some of those supplements had instead been shipped to his Moose Jaw company. What that meant was we had accepted shipment on behalf of a client that wasn't directly labeled, Goodnow said. The Health Canada inspector said, hey, you need to make sure that these things are properly labeled for the client that's receiving them. And we said, thank you. We'll fix that. Hopes dashed. Jeff Sando is now spending as much time as he can with his family. His adult children live in his house and help with his care. When he started this process, he had visions of coming home to a hero's welcome. I thought I was going to come home and walk up the stairs from my garage in here, he said. He justified the expense and the time away from family as an investment. Instead of 2 years with my kids, I would have 15 to 20 years with my kids, he said. Get to see my grandchildren. Be able to walk my daughter down the aisle. I don't know if I'll get to do any. He trailed off, overtaken by emotion. Jeff said maybe Goodnow has the nugget of a promising idea, but he hasn't developed something that stops progression in ALS. He's at best trying to figure it out. We are part of an experiment, and that's not what I signed with to be and paid him a lot of money for, to be part of a trial. Well, how's that for disturbing? I just, how on earth can somebody do something like that to people who are just, looking for hope? Hoping that they can better their lives. Hoping that, what they sold were sold this bill of goods, this I'm going to stop the progression of ALS and improve your life. How can somebody do that, tell somebody that, when they have no proof that anything works? When I read that story, I was sickened, and I was angry. And I thought, what can we do? Well, Health Canada's trying to do as much as they can, but because he's not bound by the College of Physicians and Surgeons, there's nothing they can do to stop it. The only thing I think we can do is spread the word about this story. And then, of course, there's the story about Susan Silvestri. And that will come tomorrow in part 3 when I discuss further his day in Goodnow and his medical center that is not a medical center. Sells people a bill of goods. And, I mean, really, I think what he's doing is criminal. But I'm not a lawyer, so it's not up to me to determine that. But what he is doing is disgusting. He's given people hope when there is no hope to be had. And that's just wrong. On so many levels. He'll get what's coming to him. Someday. Karma has a way of working out like that. Okay, thanks, folks. I appreciate you tuning in to check this out. Part 3 will be tomorrow when I'll tell you all about Susie Silvestri and the tragic way that she passed away because of a lack of care. This has been your Grizzly Growl for Tuesday, December 2nd, 2025. I'll see you tomorrow.